the challenges that we have in training our health workforce as well as in delivering care. And again, an example here is with the recent experiences of the global response or even the local responses to COVID. The use of technology facilitated most of that response. So what happens when this report is put together after every session, or the discussions at every session are captured, and a position paper arises out of those discussions. The issues, the main issues, the key issues that were raised are captured. Recommendations are then also captured. And all this, from all the sessions, plenaries, breakaway sessions, and keynote addresses, all this is then collated, and the output is this report that I'm presenting today. So I really would appreciate if we could give the Secretariat a round of applause for producing this report. Thank you very much. Thank you. So I'd like to foreground as a lead-in to my presentation the primary purpose of AMCOA, which is to create an environment for best practice by health professions, regulatory bodies, in partnership with member councils, and to engage other stakeholders through harmonization of standards for medical education, training, practice, and fostering compliance thereof, promotion of professional ethical practices, capacity building and information exchange, and all this will then lead to improved access to health. Now, I'm going to be sharing some highlights from the report. I'm not going to be reading the report in its entirety. Might I just, as was reported by the CEO of AMCOA yesterday, Dr. Yumbia, that the report is going to be available to the member countries, to the members of AMCOA, for us to go and engage with and adapt to our own circumstances. The conference, for those who are here, commenced with a warm welcome by the Premier of the Northwest, Mr. Kawiza Mahape, Professor Mbulayi Nemutandani, President of the HPCSA, and Dr. Jose Letlape, AMCOA President. This was followed by words of welcome by the Honorable MEC of Health in Northwest, Mr. Madoda Sambata. And in his address, he advised that as we discuss the workforce of the future, that we remember to also focus on provision of resources for that workforce of the future, and also reflect on distribution of that workforce. The Honorable Minister of Health of South Africa, Dr. Joe Phaahla, welcomed all delegates and further advised that the conference should focus on discussions around modernization of regulations, migration of the workforce, and in this regard, that in order to support the objective of universal access to care, the training institutions have an obligation to produce a workforce of high caliber. He also noted that the theme of the conference is aligned to the experiences in Africa and therefore appropriate. There is recognition that working conditions of the workforce needs to improve, and further that the throughput of specialist training was less than ideal, and this is because of pressure on the fiscus. And in this regard, wondered aloud if we shouldn't consider introducing a community service year for specialists in training. And this obviously in an effort to provide services to underserved areas in our different countries. In closing, he appreciated that there is a shift in gender equalization in the field of medicine, notwithstanding the fact that a majority more women were graduating in medicine. However, at leadership level, men still dominated. And in this regard, advised that perhaps this should be an area of focus in the future. As far as I just want to quickly go to the opening remarks and the keynote address itself. The keynote address was delivered by the Honorable Minister of Health South Africa, Dr. Joe Phaahla, and the Honorable Minister of Health of Namibia, Dr. Kalumbi Shangula. In his opening remarks, the Honorable Minister of Health of South Africa extended a word of thanks to the organizers for choosing such a very topical and thought-provoking theme, as it was a conversation that was trending globally and not just on the continent of Africa. In his inspirational talk, he highlighted the following issues. First, the need for agility of the health systems in Africa so that they are ready to respond to emerging challenges, as we had seen with COVID. He observed that part of the reason for the shortages of health or the health workforce was due to global migration. So we needed to appreciate that it's not a phenomenon that is only common to the continent or to regions for that matter. It is global. There is global brain circulation, as we say, blood circulation, as we say. He raised the question of remunerative work outside the public service as an issue of concern. This is a concept that is in place in this country. I don't know what the position is in other countries, but certainly in this country, it is an issue of concern, and this is what the minister raised. So in the regulatory review that the HPCSA should be undertaking in future, this is an area that they must ponder. And he raised also the use of technology to answer some of the challenges that we have in training our health workforce, as well as in delivering care. And again, an example here is with the recent experiences of the global response or even the local responses to COVID. The use of technology facilitated most of that response. And he concluded the talk with the question as to how Africa will adapt to the changing work environment, for example, in the use of artificial intelligence to offer services in an ethical manner. The Honorable Minister of Namibia, of Health in Namibia, also extended a word of thanks to the organizers and commended AMCOA for the theme chosen for the conference, again because of its relevance to Africa and globally. In his talk, he focused on the following issues: the urgent need to be responsive to the needs of health, the health needs in Africa as it pertains to the workforce training, and emergency preparedness. And he also raised the concept of brain sharing in the region, that there is a need for brain sharing in the region so that expertise does not, we don't have flight of expertise from the continent or from the various regions to overseas destinations. And there was clearly, in that regard, there was also a need to examine the push and pull factors in the work environment so that you understand what incentives could be brought to bear to retain people in the system, and what are those factors that we need to eliminate that push people out of the system. And he also spoke on considering what are the obstacles, what are the hindrances within our regulatory framework that makes it difficult for healthcare workers to be registered as they move. He highlighted areas of concern and proposed remedies basically across education and training, recruitment of healthcare workers, scope of practice, harmonization of the regulatory framework. And he was also in favor of a Pan-Africanist approach, the Pan-Africanization of delivery of care on the continent. And I think, as we heard yesterday, the principle or the concept applies to both the teaching and training as well as the delivery of care in sharing resources, sharing knowledge, sharing expertise. In the roundtable discussion, so we had roundtable discussions, plenary sessions, and concurrent sessions, which focus on different themes, and I'm going to just reflect on a few of those. The roundtable discussion, the question that was being addressed was, how do we move to Pan-Africanization within the health regulatory environment? And the key issues, there's a list of about 12 issues here that the panel thought were key to delivering on this idea of Pan-Africanization. And I'll just reflect on some of them. And this is a recurring theme. Harmonization and standardization of training curricula for health professionals was a key issue for consideration there. And the need to find innovative ways to deal with cross-border migration. The question about cumbersome registration processes speaks to this as well. And then, I think importantly, one of the key issues that the panel raised was that policies and regulations that regulators develop must not be understood only by us, mustn't leave anyone behind. The workforce must own this as well. And the challenges that the panel identified included language barrier, that in our engagement within the regulatory associations on the continent and the various countries, we need to be cognizant of the fact that not all are Anglophone, so we need to be inclusive, we need to include everyone. So language was an important thing. And again, cross-border migration, again, was a feature. And poor remuneration of health workers, a critical consideration there, as well as lack of commitment of resources, so that the delivery of care must match international standards. What recommendations were made? We need to develop advocacy packages. We need to identify leadership and infrastructure for the realization of the Pan-Africanization concept. So it mustn't just be left to realize itself, but we actually need to put resources in that direction so that somebody or someone drives the delivery of this concept. Development and implementation of sustainability and growth plans, and establishment of regional centers of excellence and sharing of resources. And then we had plenary sessions excuse me, to discuss various sub-themes. And the key issues that were identified: one, inadequate human resource planning in the Africa region. Obviously, this occurs to a variable extent across the continent. The need to future-proof health professionals. And in this regard, there was an endeavor made to identify the attributes of the kind of health professional that would be fit for purpose for this future that we envisage. This individual should have people-centered interpersonal skills, must have decision-making and analytical skills, must be competent with digital technology, and must be driven by evidence basis of practice and professional knowledge, and they must be professional, and their personal conduct must be of the highest level. They reflected on, and again, a lesson learned from the COVID environment, the peddling of misinformation, which obviously then impacts the quality or the effectiveness of the care that is being proposed or delivered, and the need that you need to equip the health workforce that we're talking about for current and future needs of the health system. The following challenges were identified: brain drain, and again, you would have heard this being mentioned in practically all the sessions. And then there was a reflection on regulatory bodies and how impactful or not impactful they may be. And one of the issues that arise here is a credibility gap, because there is a perception that there is loss of public trust in the regulatory bodies. Various examples were given, I think we would have heard of that. And again, the question of us developing these complex regulations that are only understood by ourselves, the need to ensure independence of regulators from government interference, and again, another recurring theme, multiple regulators in the same country working in silos and not collaborating on common issues. The question of harmonization of curricula came up again, and in developing this healthcare system of the future, a caution to start moving away from this hospice-centric mode of delivery that is a feature of our systems currently. What recommendations were made in terms of training? Again, is standardization and harmonization of curricula, in terms of regulation of health professionals, mutual recognition of health professionals across the continent, standardization of requirements for registration and licensure, and there was a discussion